Are you self-conscious about puffy nipples? This is how we go about getting rid of them at Cryo Clinic. Hello, my name is Omar Tillo. I'm the medical director of Cryo Clinic and senior body contouring plastic surgeon. I have a full playlist on gynecomastia, which I'm going to link in the description. What causes puffy nipple in men? The most common cause of puffy nipples in men is a condition called gynecomastia, which is an enlargement of the breast tissue under the nipple. That can cause protrusion of the nipple area. Another common cause of puffy nipple and gynecomastia is the use of hormones such as growth hormones, anabolic steroids, some medications used normally in medicine, as well as conditions that affect the level of hormones such as increased estrogen or reduced testosterone, and very rarely some growth directly under the nipple. So how do we treat gynecomastia? Gynecomastia can be treated surgically, and that using techniques such as liposuction, which actually removes the fatty component of the gynecomastia. Another option is the open excision of the gland, so where we make an incision within the skin to remove the glandular part of the gynecomastia. And very often we do a combination treatment where we do liposuction and open excision at the same time to get a smooth, uniform reduction in the area. Liposuction works well if the volume is mostly due to fat tissue, and that can be related to obesity or overweight. The open excision of the gland, it's the only way to get rid of the glandular part of the gynecomastia, which is the actual breast tissue, and that is more linked to hormonal changes. Most often, majority of the times, we find a combination of the two. So there is a gland part related to hormone changes as well as fat tissue. That's why we combine both the liposuction and the open excision. So what are the non-surgical options to treat gynecomastia? Well, number one option is not to do anything because it's not a medical condition that will affect health. Second options, there are hormone suppressant, estrogen suppressants such as tamoxifen, tends to work in the proliferative stage of the gynecomastia. When it's growing, it can suppress it. Other non-surgical options to address the gynecomastia is healthy lifestyle, good diet, reduce the fat intake. Weight loss tends to reduce the volume of the fat tissue on the chest, so it would reduce the volume of the gynecomastia in general. And also the less fat tissue we have on our body, the less estrogen is produced, so that also can interfere with the glandular part of the gynecomastia. Another important thing which can help is avoid substances that can trigger gynecomastia, such as growth hormones and anabolic steroids in the context of bodybuilding or non-medical use. So when it's the right time to see the doctor if you have gynecomastia? So if you have a gynecomastia that is lasting for several months, 6 to 12 months, and it doesn't seem to reduce with hormone changes or with life changes, then would be a reasonable thing to see your doctor. However, if you notice any sudden change, a sudden growth in one or both sides of the chest, especially if it was associated with lump, any pain, tenderness, then it's essential that you seek medical attention immediately.